Hello and welcome to episode 12 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott, here to talk to you about how to get through a low back flare-up. If you tuned in last episode, we discussed anterior pelvic tilt, the ins and outs, what you need to know, how it's not a diagnosis, how it's a posture, and we reduced the threat of that through some evidence-based literature and discussed how you can get rid of those notions and find the right help regarding that. This week, we're diving into a more specific topic in regards to if you are dealing with the low back pain, disc herniation, sciatica, and you experience a flare-up, which is quite common. Everybody goes through flare-ups. Even clients in my online program will experience flare-ups at time. Well, not will, but they can. It's relatively common. No rehab program and no recovery is perfectly linear. There is ups and downs because there's so many factors that influence pain. And we are going to discuss some of these factors. We're going to discuss my top tips in regards to if you are going through a flare-up, what you can do about it to calm the low back down, to calm the disc down, to calm the nerve down so that you can recover from these flare-ups quicker and ideally get back on the plan so you can continue the proper path forward and you can continue towards success. Now, this is all based on the notion that you have a proper structured plan. You have to have a proper structured plan. Otherwise, if you're just getting routine flare-ups every week, every month, every few months, and this is just part of your life, there's really not much of a point in implementing these tips because it's just going to keep happening, right? So these tips are going to help you get through a flare-up. They absolutely will. I can guarantee you that. But if you're not doing something about the low back through a comprehensive and a structured way with proper guidance afterwards, it's just going to keep happening. So it's kind of just like throwing, a little bit of water on a fire, but not completely dousing the fire or restructuring or whatever analogy you want to use. That means addressing the root of the problem. So for my programming, for my coaching, I'm going to use the example of disc herniation or sciatica because everybody in my program has low back pain, disc herniation, sciatica. That's all that I do. That is all the coaching I do around the world. So let's say you've been diagnosed with a disc herniation and maybe you have some sciatica going into the glute or the hamstring, something like that. And you're doing okay. All right, you're doing all right. And now something happens. That something could be poor sleep. That something could be an emotional stress response. That something could be personal stress. Maybe it's related to a sick family member. Maybe it's related to your job. You're at risk of losing your job, or there's a lot of stress at work. Or maybe you were feeling decent enough to get back in the gym or to run or to be active in some way. And you overdid it. You can tell something's just a little bit off after that workout or at the end of that day. You're starting to feel it heat up a little bit. And you're like, uh-oh, I'm not sure about what tomorrow has in store. You wake up, the low back is super tight, flared up. You have more symptoms in the leg. Things do not feel good. You have a flare-up. Oh my gosh, how long is this going to last? Weeks, months, what do I do in this situation? So I'm going to give you 3 top tips for overcoming a flare-up. All right. First, it is so important to understand that hurt does not equal harm. Just because you're experiencing a flare-up does not mean you have significantly damaged your low back any further. You got to understand that because flare-ups will send people into a panic mode. When you're in a panic mode and the mental aspect of these things start roaring and rolling out of control, it is only going to make things worse. It's only going to make things worse. So you need to understand, and this is all tip 1 right now, you need to understand that pain is not the same thing as tissue damage. Hurt does not equal harm. Understand that. Okay, I feel more sensitive. I feel more pain, but that does not mean I made the condition worse. It does not mean I damaged anything. It doesn't mean anything's out of place. It just means something happened to increase my sensitivity. Now, based on that thought, this is still under tip number 1. Based on that thought, you can start to analyze what happened that day. Was it a new workout? Was it a new exercise? Was it something at work? Was it a emotional stress, a family-related stress? What else is going on in your life that could contribute to that? Because if you believe, oh, I must have tweaked something, but there's no new movement, there's no new workout, there's no physical relationship to what might have happened, you might find, and more times often than not, you might find it's related to something external from a physical movement or reason to blame. This is very, very common. And if you can understand that and you can draw the link between these things, it's going to decrease the threat level of the pain, and that alone will help you get through the flare, because you can think, okay, I get it. My mom's sick, or my brother is sick, or my spouse is, not in a good place. Okay, I don't feel good about that situation, of course, but I understand that that's why my low back is flared up, because these additional stressors are causing my nervous system to be a little bit more sensitive. And now I'm, my thresholds are lower, and the excitement of pain can be increased. Okay. Happens all the time. Understanding this, though, can be quite powerful for getting over a flare and for healing. Tip number 2. Some people, in fact, multiple clients that I will have in my online program, once we start to find the right movements for them that start to calm their symptoms down, reduce their sciatica, reduce their disc herniation symptoms, they're under the impression that the second they experience a flare-up, they need to rapidly increase the frequency of those movements. Oh, these movements, these exercises initially helped my back, it helped my disc herniation, helped my sciatica. So because I'm in a flared up state, I need to do a lot more of them. That's actually not true. It's because, once again, if something's in a flared up state, it doesn't really like much of any movement, at least no specific targeted aggressive movements to the low back. So if the disc is flared up, if the nerve is flared up, if you're feeling more symptoms down the leg, immediately going, oh my gosh, okay, so I'm going to do this exercise all the time now, all day long. I'm going to do a million stretches. That sometimes can make things worse. Okay. So do not immediately do a vast amount more, a large increase in volume of previous rehab movements that worked for you. You need to slowly scale them in. That's tip number 2. Tip number 3 is going to explain kind of how we scale it in. Tip number 3, there's something that I call the breathing position, or the resting breathing position. I call this 90-90 breathing. I have all of my clients learn this. Every single one of my online clients learn this. This is in my program. It's built into it. Imagine that you're sitting on a couch, okay? Instead of sitting on the couch, you're going to spin around. You're going to lay on the floor. You're going to lay on the floor right in front of the couch. You're going to scoot your body. You're going to scoot your butt next to the bottom of the couch, and you're going to rest your legs up on the cushion that you were just sitting on. Now, you could do this with the chair. You could do this with the table. You could do this with anything. So the position here is you're on your back. Your thighs are straight up and down. Then your knees are bent, and your lower legs are now also parallel to the floor. So your knees are at a 90-degree angle, and your low back is flat on the floor. This is a very comfortable, for most people, a very comfortable position for the low back. And it just completely turns off all of the muscles of the low back. So those muscles that might have been spasming because of this flare are going to turn off and relax. In this position, you can practice belly or abdominal breathing. So to further help all these muscles calm down around the low back and around the core and to let all the spasms stop, I encourage you to even use your hands or your fingers to push into your lower abdomen, your belly, and really focus on belly breathing, feeling the expansion of air through the belly, using the diaphragm, and feeling it not only forwards into the belly, but to the sides and even to the back into the floor. This is going to teach you proper diaphragmatic breathing, proper belly breathing, And it does an amazing job at calming down the low back, calming down the flare up, getting rid of the spasms, and just letting all that tension melt away. Melt away. So what I advise here is, if you're in a flared up state, to really only focus on this 90-90 breathing for about 48 hours. Don't jump into a bunch of aggressive movements like I mentioned in tip 2. Let it chill out. We got to let it chill out. This is our homemade ibuprofen here. This is our homemade anti-inflammatory, our homemade NSAIDs. You're going to lay on your back. You're going to let that low back rest flat against the ground. You're going to practice your belly breathing. You're going to let everything mellow out, chill out, so that things are calm. This is going to rapidly accelerate the rate at which your low back calms down. Now, once it starts to calm down, and I'm just estimating here, let's just say 48 hours, you should start to think, okay, I can breathe better. I have less spasms. Things are starting to loosen up. Now we can start to reintroduce gentle movement, not aggressive movement, not jumping right into the maximum level of the rehab exercises that we were just doing, but slowly scale them back in. So maybe in 72 hours or 48 to 72 hours, now you feel good enough to start going on gentle walks. Do gentle walks, slowly scaling. Don't jump into a 2-hour walk. Go do a 10-minute walk, and then a 20-minute walk, and then a 30-minute walk. Get your body used to some gentle movement. If you're doing okay, now you and I strategically can start reintroducing some of the initial rehab movements that we learned were right for you, or perhaps that you found on your own if you're not currently under the care of a online low back coach or provider that specializes in these types of things. You can start to reintroduce the more basic levels of these exercises around the 48 to 72 hour mark. Then it's just scaling from there. So 3 days, 4 days, 5 days, 6 days, we slowly start to scale back up. We want to be at a point to where within 1 week to a week and a half, we are right back to where we were, right back to the point at which we dropped off. So to the maximum level of the rehab movements we were doing. We want to be right back there without spasms, without any sensitivity. We want to understand why that flare-up occurred in the first place through discussions like I introduced this podcast with in regards to any external factors that might be related: sleep, nutrition, emotional stress, personal stress, family stress, any outside factors that might be related, and to better control those and understand those. And if it was related to a physical stress, like you did a new exercise you weren't prepared for, or more of a particular activity than your body was prepared for, we are going to restructure that approach to make sure that we slowly scale into that exercise. We're doing the movements that are right for you at this time. We don't risk re-flaring it up, so we can continue the progress that we are making and continue to see those gains and restructure your plan so that it is cohesive and it makes sense to you, so you can continue to make progress and get back to the things you want to do, but maybe not in a aggressive or reckless pace. And you can understand why the flare-up happened, which is extremely important. And if you can understand why it happened, you know how to prevent it in the future. So you're not going to be stuck in this cyclical routine of flare-ups every week or flare-ups every 2 weeks or every month. You're going to know how to not only get over the flare-up, but stop them from occurring again in the future. And that is why we explore these 3 primary tips to helping you recover quicker from flare-ups and understand why they might have happened in the first place. If you learned something from this podcast, please rate, review, and subscribe. If you feel as though we're worth a 5-star review, please leave one, as it will help the podcast reach more people. It will help it grow. It will help it climb the charts, so to speak. And once again, if you're on YouTube, please leave a comment for the algorithm. Please subscribe so we can continue to grow the YouTube channel as well and reach more people and help people find the help that they deserve, so that if they are struggling with flare-ups, they're struggling with getting better, they don't have a comprehensive plan, that perhaps I could help them get the right plan together so that they can continue to see progress, get back to their goals, get back to 100% quality of life, and we can put together a structured plan for them. But finally, thank you so much for listening today. Thank you so much for caring about low back issues and how to properly recover in an evidence-based and efficient pattern. And I hope you have a great day.